Today, the world celebrates World Toilet Day, and I am so very pleased to be with you here in this webinar. What is so great about this day is the multitude of activities that are taking place. This morning, I was in the Place des Nations in Geneva, where there is a huge inflatable toilet installed for this day. And for those of us who were lucky enough to be there, we were given these T-shirts to wear. Also in Accra, in Ghana, there are schools dedicating a day to teach the students about the topic. Tonight, in New York, there is an exhibition about the UN's sanitation campaigns and a discussion led by the missions of Singapore and India to the UN. And right now, I am here with you. I would like to sincerely thank you for engaging in this discussion that is often complex and surrounded by taboos. World Toilet Day this year is dedicated to the theme of nature-based sanitation solutions. This means solutions that work in harmony with nature and that can speed up progress for the 4.5 billion people that live without safely managed sanitation. This webinar is about the new WHO guidelines on sanitation and health. Current sanitation programs are not achieving anticipated health gains, and there is a lack of authoritative health-based guidance on sanitation. Implementing the WHO guidelines on health and sanitation will be key to meeting the Sustainable Development Goals. In 90 countries, progress towards basic sanitation is too slow, meaning that they will not reach universal coverage by 2030. This is something we want to start changing today on World Toilet Day. And change starts by getting informed. This reminds me of a similar initiative that we launched in 2016 here in the ILO. We published Wash at Work, a self-training handbook that we developed with member states, social partners, and NGOs, many of which are here with us, to promote, to provide tools and instruments to promote occupational safety and health. It was also launched on World Toilet Day, just like these guidelines. So it shows that it is a good idea to have these kind of tools. I will stop here and give the floor to WHO. I wish you an interesting and fruitful webinar on the important and life-saving topic of sanitation.
You can just
go ahead.
Okay, well, thank you very much, Carlos. I want to thank everyone that has signed up and registered for this event. Like you, I was down at the big inflatable toilet just an hour ago. There's a lot of events happening, and there's a lot of media interest and interest from everyone. And I think the question that we're always being asked is, look, how does one do sanitation better? What do we need to do? And as you just alluded to, there's been a lot of questions and a lot of studies that have come up lately that have raised concerns about how we do sanitation programming and what are the most effective policies to pursue. So with that in mind, WHO embarked on probably its biggest normative initiative of the last 20 to 30 years to develop these sanitation guidelines, which looked at literally thousands of studies on how sanitation was being done and what impacts they had. This is one of the big new strategic pillars of WHO. This is state-of-the-art evidence. It's only been out for, I think, about 6 weeks or so now since its launch. So this is, you're one of the first audiences that gets a chance to benefit from some of the knowledge that's been gained through this evidence review. Now, before I turn the floor over to our technical experts on this, let me just quickly outline the main recommendation areas so that these are kind of in your head as you hear the more detailed information. The first is, it's no secret, we need to do sanitation better. And when we talk about by doing sanitation better is we need to have better coverage. We need to get up to cover entire communities, because even if there's a small percentage or a percentage of folks that aren't getting, and families not getting sanitation, then there's fecal-oral contamination. If that excreta is not being treated properly, that again is in a sense poisoning surrounding communities and families. So really the quality of interventions is essential, and this really needs to be embedded in local planning. That's the third pillar of this. We can't retrofit sanitation anymore. It needs to be planned ahead from the beginning, and that means lots of good coordination at all levels between governments and NGOs. And finally, from our perspective, the health sector needs to actually stand up and play its normative role, convening, setting standards, and really providing a lot of surveillance so that we know, and all of you know, what's working, what's not, and when things need to be corrected. So thank you again for joining this. We're going to make it fun and entertaining, I promise, and in the spirit of World Toilet Day, answer some of those questions that I'm sure are on your mind. So with that, I'm going to jump out of this chair and wish you the best.
Okay. Thank you, Bruce. And my name is Kate Medlicott. I'm the Sanitation and Wastewater Team Leader here at WHO, based in Geneva. As Bruce said, we are going to try and make this a bit fun for you, but you're going to have to endure me for maybe 10 minutes or so in the beginning to give you a quick overview of the guidelines, and then hopefully we'll get to the more fun part that Sophie and I will lead, and then we'll be opening up to a broader discussion where you can ask your questions of us in the chat box, and we'll do our best to respond to those. Okay, so if you follow along with me here in the presentation, I'm going to give you an overview of the contents of the guidelines. Okay, so firstly, just to be really clear, that these sanitation guidelines are supported at the highest level within the World Health Organization because, as this quote here from our Director General shows, sanitation is really at the perfect expression of WHO's mission. That's a complete state of mental, physical and social well-being. And these guidelines underpin so much of what we're trying to do in terms of improving public health globally. So why are these guidelines needed now? As Bruce said, the evidence on sanitation, when we look at it all together, shows that we're not having as much impact on health as we might expect. Certainly the justifications for sanitation interventions are always that they will lead to public health outcomes, but we definitely need to do better at making sure that we really break transmission of disease. And one reason that we're not seeing the impacts that we might expect is because ministries of health have kind of retreated from sanitation service delivery over the last 50 years and are working more in a more treatment style medicine. And there's also been a lack of public health based guidance on how we maximize the health benefits of sanitation interventions. So this is really the background and the gap that these guidelines fill. So now here I'm just going to lead you through the structure of the guidelines. The guidelines are divided into 4 main areas. We have an introductory section, of course. There's the core evidence-based recommendations and good practice actions. There's 3 chapters which provide implementation guidance, and then a number of chapters providing technical resources. So what I'm going to do now is just to lead you through each one of those chapters and just give you a very brief summary of what's in there. The intention is that we whet your appetite, get you thinking, and encourage you to dive into the guidelines a bit more yourself and follow up on the areas that match your interest. But first, what I wanted to say is I'm not going to, bore you perhaps with the details of the evidence review process, but what you need to take away from this slide is that for WHO, guidelines development is a pretty serious business, and when we use the word guidelines, it means we've followed the most rigorous process of evidence review and recommendation development. and that we've involved a broad range of experts and end users in that guideline development process. Okay, so now to the introduction. Let's line this camera up a bit better. Okay, so the objectives of these guidelines are, of course, to maximise the health impacts of sanitation interventions, and as Bruce said, we want to be really clear about what is the role of the health sector in delivering sanitation services. But at the same time, we of course know that sanitation is delivered by a wide range of actors, not just ministries of health, so the audience for the guidelines is much broader than that and really speaks to all actors working in sanitation service delivery. And likewise, when we talk about sanitation and health, we're accustomed to thinking about diarrheal diseases. The guidelines looked at all health endpoints associated with sanitation. So these are the fecal-oral infections, intestinal worms, of course, but also secondary infections and broader well-being aspects such as school absenteeism, poverty, and even antimicrobial resistance, which is becoming a much bigger topic at the moment. Okay, and another thing you'll find in the introductory section is a new F diagram. For those of us who have been around for a while, this old F diagram in the bottom right-hand corner here is probably extremely familiar. And while it's been a very useful way to think about sanitation and health, it's also had some limitations in that the way it depicts a toilet barrier, as you see there, is a rather simplified message about how sanitation systems work. So this new F diagram here you'll see under the column called sanitation hazards, we've really unpicked the whole sanitation chain to be clear that lack of access to a toilet or leakages and failures at any point along the sanitation chain can lead to excreta in the environment and eventual exposure and one of the disease outcomes we mentioned on the previous slide. Okay, I'm going to go through the core recommendations now. Bruce touched on these, and we're really just paraphrasing here where you'll find a lot more detail within the guidelines document themselves. So recommendation area 1 is about universal access to toilets that safely contain excreta. So the key messages here is we're talking about covering entire communities, not a percentage of the community, but making sure that we reach everybody in a community and reach them with a minimum level of service. So that's a safe toilet that safely contains excreta. And the approach to doing that is using supply and demand side approaches concurrently. So you may be very familiar with some of the demand side approaches such as community-led total sanitation, but making sure that those are paired with supply side approaches, making sure that we have high quality technologies delivered through market-based approaches. Another key point is that in order to reach entire communities, shared or public sanitation may be necessary as an interim measure if there's no other option in order to reach everybody. Of course, people need toilets at home, but the recommendations also talk about other settings, particularly schools and healthcare facilities, and ensuring that we're targeting our interventions so that progress is equitable. So recommendation area 1 had a very strong behaviour change component. That's making sure that everybody has access and use of a decent toilet in all settings. Recommendation area 2 is much more about what happens downstream of the toilet, making sure that those safe toilets that contain excreta are actually connected to a safe sanitation chain. So here we're talking about containment, transport, treatment, and end use and disposal. But in terms of the technologies to achieve a safe sanitation chain, the guidelines are actually what I would call technology agnostic. So they don't favour sewage systems over on-site systems or container-based systems, but they set out some clear criteria for what safety looks like at each step of the chain and acknowledges that the best solution will be very context-specific. This recommendation area also acknowledges that achieving a safely managed sanitation chain is a very high bar to achieve in some settings, and that we need to make incremental progress towards a safely managed sanitation chain, and the way that we do that is by using a local level risk assessment process. This recommendation area also touches on sanitation workers, so it's a special mention of the need to protect sanitation workers because we know that they're often the most exposed in working in some of the most unpleasant and difficult working environments. Recommendation area 3 is really looking at sanitation as part of local services. So I think all of us in the sanitation sector have been really pleased to see over the last 5 years some genuine expertise and very well thought out programming on sanitation. And we definitely want to see that continue, but also acknowledging that in order to be efficient in terms of resource allocation and also making sure that the interventions are sustainable and achieve the health outcomes we anticipate, they need to be coordinated with other local level services. So things like solid waste and transport, but also safe water supply, hygiene, animal waste management and child feces management at the community level. Recommendation area 4 is really all about the role of the health sector. So the important thing here is that making sure that the health sector is stepping up and fulfilling the core functions that the health sector should be fulfilling to ensure sanitation systems are safe, but also not taking on functions that are better done by other actors. Okay, so that's kind of the heaviest slide. If you're tired, we're going to go a little bit faster from here on in. Now I want to summarize some of the implementation guidance. So chapter 3 is where you'll find all of the definitions. We talk about a safe sanitation system or a safe toilet, safe containment. This chapter really clarifies exactly what we mean from a public health perspective by safe at each step of the sanitation chain. So it includes, the definitions include aspects related to the design and construction of sanitation facilities at each step, and also operation and maintenance requirements. And it also includes what we call incremental measures, acknowledging steps that might be necessary if the highest definition of safety cannot be achieved. By now you'll be very familiar with the JMP definitions, the new monitoring ladder which has a safely managed bar at the top. So these JMP definitions define safely managed sanitation, and the guidelines definition that I just showed you also includes definitions at each step of the chain. So these two definitions are absolutely complementary. The difference is that the normative guidance within the sanitation guidelines go a bit deeper, so they catch the things that can't necessarily be monitored at the global level through household surveys or regulator reports, and they provide a lot more detail for implementers. They certainly do not lower the bar. They are held to the same normative standard, but the guidelines provide much more detail. Okay, chapter 4, this is one of the largest and richest chapters within the book, and it's really getting to the how. So you can think about the recommendations is the what we're trying to achieve, and Chapter 4 on the enabling environment for safe sanitation service delivery is really about the how we get to these targets. So there's kind of 5 key points here, which is about multi-sectoral sanitation policy and planning, health protective legislation, regulations, standards and guidance, roles and responsibilities within the sector, how to work on a local level risk assessment, and importantly, aspects related to developing sanitation business models and markets. It also acknowledges that there's special situations such as emergencies, outbreaks and healthcare facilities that have different requirements, and there's guidance there as well. Okay, Chapter 5 is all about behaviour change, perhaps some of you there are engineers like me. Behaviour change is perhaps one of the harder things to grasp, and certainly we've seen certain kinds of behaviour change approaches be very widely implemented. What this chapter does is really stand back from some of those off-the-shelf behaviour change approaches and encourages implementers to really understand behaviours and the determinants of those behaviours and design interventions that really get to the root causes of behavioural the behaviour change we want to see. It's understanding the institutional responsibilities for behaviour change, and also building in learning and monitoring so that we can adjust those behaviour change approaches as we understand behaviour in communities better. Okay, now to the technical resources. There's a whole chapter on excreta-related pathogens, and so if you're really wanting to understand certain diseases associated with sanitation, this is where you'll find the technical information on that. I talked about the updated F diagram. You'll also find some tables of all of the sanitation-related pathogens, treatment and control measures, and some information about antimicrobial resistance. So here's an example here of the type of information you will find on excreta-related pathogens, looking at the 4 classes of pathogens, that's bacteria, viruses, protozoa and helminths. So now just to really quickly summarize the evidence, and this slide actually doesn't really do justice to the enormous amount of evidence that was reviewed for this, but for the sake of this webinar, we've boiled it down to just 5 points. But I would, if you're interested in what the evidence says, I would really encourage you to dig deeper into this chapter. But essentially, it's this. And some of it's quite obvious, I think, but bears repeating. So with limited increases in coverage and use, clearly we see a limited impact on disease transmission. So this is really the foundational point about getting to high levels of community coverage and decent quality services. And despite some rather disappointing results recently on some large studies, overall we do see a protective effect of sanitation on infectious diseases and nutrition. And we also see evidence of association on wider health outcomes, especially personal well-being, cognitive development, especially among women and girls. But what we need to really take out of this is that the strength of evidence is generally low. There's a number of reasons for that, but in part it's due to the type of the studies, and it's also quite common for environmental interventions. Finally, I should say that there's really significant gaps in our understanding, and there's a lot more work that can be done to understand the way that sanitation interventions are implemented in order to improve our work in the future. And that leads us to Chapter 9. So if any of you who are joining here, if you're from the research community, this is where you can look to see what are the really important questions that need to be addressed in order to improve our work in the future. Specifically, this is the conceptual framework or theory of change that was used to evaluate the evidence. So this is hopefully sort of self-explanatory, but of course we want the sanitation intervention to lead to access, use and sustained use, a lowering of fecal load in the environment, reduction of exposure, and then eventual improvements in health. The reviews looked at all of these areas, and certainly what was found, although there's needs for research in all of these areas, there was a real gap, I think we could say, at the top left-hand corner of this diagram on the sort of implementation science and policy work around sanitation, as well as the middle part of the chain around what's happening with fecal load in the environment. Okay, so I'm coming to the end now. Annex 1 is just to point out that there's system fact sheets for the 11 most common sanitation systems, and we're currently working on sanitary inspection forms. Some of you may be familiar with the existing inspection forms for drinking water. The sanitation system sanitary inspection forms follow a very similar format, and they will work as a complementary set. And we're also working with the drinking water group to update the excreta-related pathogens fact sheet. So while the existing chapter provides some information there, we'll be developing harmonised excreta-related pathogen fact sheets with the drinking water group. They'll be coming out sometime next year, so just a heads up to look out for those. Okay, so I promised that we'd get through the boring bit, and now just to see whether you were listening, we're going to do a little quiz. So I'd like to introduce my colleague Sophie Boisson. Sophie's also been working extremely hard on this guidelines development over the last several years. And what we're going to do is give you a little quiz. So you're welcome to kind of just answer the question in your head if you like, or to I'm not sure if you can unmute and yell out the answer, but you're welcome to try that if you like. Sophie's going to be the quiz master, and I will I'll provide a little bit of feedback on which answer was correct and why. Okay, Sophie.
Okay, sorry, I don't think there is, well, we have to squeeze a little bit. But okay, so the first question is, what is the ultimate health outcome the guidelines aim to support? So we give you a little time to think about the 4 answers. Number A, reduction of 30% of diarrhea by 2030. Number B, reduced stunting. Number C, a state of complete physical, mental and social well-being, and not merely the absence of disease. And D, eliminating the risk of AMR. So think about it for a few seconds. Okay, so I'm sure most of you got the answers right. It's number C, and that's the WHO definition of health.
Yeah, so the slide that relates to this is table 1.1 of the guidelines, and there you can see all of the direct impacts associated with sanitation, as well as the preceding infections and broader well-being. Okay, question 2.
What does WHO recommend with regards to shared facilities? A, get rid of them. B, turn them into small-scale businesses. C, can be promoted for households as an incremental step when individual household facilities are not feasible. Or D, the SDG 6.2 ladders count shared as lower than basic service, therefore shared facilities are not recommended. Okay, so think about it for a few seconds. The answer is number C.
Okay, so there's I think a group of people, especially working in countries like Ghana, that you know, or working in dense urban communities, will be interested in this one. I mean, the guidelines are clear that shared and public facilities are okay in situations where that's the only option necessary in order to reach everybody. So really ensuring that complete community coverage is achieved.
Okay, number 3. What is the role of the health sector in sanitation as defined by the guidelines? Number A, nothing. The sanitation sector is most efficiently managed by utilities in the private sector. B, all healthcare facilities should sell toilet slabs. C, the health sector should take over all sanitation sector functions to ensure they protect public health. And D, the health sector should fulfill core functions to ensure safe sanitation, protect public health.
Okay, I'm seeing a few responses in the box here. It's interesting. The answer is D. So we're certainly not suggesting that the health sector should completely take over sanitation, but there are some very important core functions, you can see them here, that the health sector needs to fulfill to ensure that sanitation interventions have maximum impact on public health. Okay.
Question 4. How do the guidelines define safe sanitation systems? So number A, use of improved facilities which are not shared with other households and where excreta are safely disposed in situ or transported and treated off-site. Number B, separate human excreta from human contact at all steps of the sanitation service chain, covers design, operation and maintenance, and incremental measures to manage risk. Number C, available, accessible, acceptable, affordable for all users. And number D, toilets with a lock on the inside of the door.
Okay, I'm seeing some answers come in.
Lots of B's. That's really good.
Yeah, the answer is B. In fact, actually, this one, the only one that is really wrong here is D. C is the human rights criteria. A is the JMP definitions, which is how they're defined for global monitoring, but B is the most correct, the most full definition. We talked about that here when comparing the JMP definitions with the normative definitions in the guidelines. Okay, next question.
Question 5. How should local authorities prioritize improvements and manage system performance? Number A, conduct a local level health-based assessment and management. Answer B, conduct an X-Factor style competition to decide where to allocate services. Number C, provide services to people who can pay for them. Or D, deliver services where it's easy and cheap to do so. Okay, lots of A's, I can see.
Yeah, that's of course. I hope nobody's picking B. Yeah, so this is really what's contained within recommendation area 2, talking about incremental improvement based on local level risk assessment. And there's a number of different approaches we can use for risk assessment. Certainly the excreta flow diagram has become a very popular and an effective tool at high-level political communication about where the major risks are in the system, and WHO promotes sanitation safety planning as a management tool for managing and coordinating the sanitation chain. Okay, next question.
On to number 6. Which sanitation technology is the best for protecting health? Number A, sewage. Number B, on-site systems with fecal sludge management. Number C, container-based sanitation with off-site composting. Or number D, none, or all of the above, depending on management and context?
Okay, it looks like you guys are too smart. We're seeing lots of D's, and that, of course, is D. Sanitation systems are extremely context-specific. But what we want to see, if you look at this diagram here, is an example of phasing out unsafe service types over time. So at the far right of this diagram, you see a mix of safe sanitation service types that are context-specific, and the unsafe ones, such as open defecation, manual emptying, shared facilities being phased out over time. Okay, I think we're coming to our last, oh no, just a little bit more to say here, sorry. Under table 3.5 with the technology fact sheets, you'll see some guidance on the physical factors and enabling environment factors that would mean that any technology type or system type is more suitable in certain settings. Okay, coming to the last question, or second to last question, I'm losing track.
Question 7, what is the best way to get people to change their sanitation behaviors? So number A, implement CLTS. Number B, tell them what to do, posters are great. Number C, explain to them how poor sanitation affects their health. Or D, understand what drives behavior and design a context-specific intervention. Right. Everyone seems to get it right.
Yeah, the answer is D, and perhaps it doesn't need too much explanation, but certainly we know in our own life, just posters or people telling us what we should do is generally not a great way to get people to change their behaviour. And while CLTS has been promoted successfully in some places, it needs contextualization and a broader behaviour change design and evaluation thinking to make sure that it's achieving the effects we would hope in all settings. Okay, so this is the slide that related to that, and you can find a lot more information in Chapter 5 on behaviour change. Okay, I think this is really the last one.
So, how sure are we that safe sanitation systems have a beneficial impact on health? So number A, there is evidence that safe sanitation is associated with improvement in health, but the quality of evidence tends to be low. Number B, we think so, but there is no evidence. Number C, we have no evidence. Sanitation is not important for human health. We're going back to the miasma theory. Or D, don't be so silly.
Okay, you guys are a sharp lot. I see lots of right answers coming in there. Yeah, that's right. We know that there is a strong evidence base for sanitation, but there's a lot more we can do to improve the quality of this evidence. We don't need to be too rattled by recent studies. You know, the theory of change is not broken, but we do need to do a lot better in terms of the way we generate evidence and also in terms of the way we implement our interventions. And that's really what these guidelines are here to do. Okay, and as I mentioned, these areas within the theory of change that are marked red, those are the places where some of the biggest gaps in knowledge are, but there is more to be learned in all of those spheres. And as I said, those are the research priorities. Okay, so that brings us to the end of our presentation, and I think we have about 15 minutes left for discussion. I believe Francesca, is that right, is going to be monitoring the questions box, and we'll do our best to try and respond to any of the questions you may have. So do we hand back to the moderator for this, or to Carlos? Carlos, are you able to help moderate some of the questions that are coming in?
Indeed, I can. So thank you for this summary presentation. It was quite comprehensive, and I can see that the audience was quite sharp in catching your messages. Now, I do have to say that the guidelines, this is really a summary presentation. It was very good, but there is something for everybody in these guidelines. I, who come from the ILO, from the International Labour Office, have to say that a quick look showed many references to workers and to the advice, both for the role that workers have and for how sanitation affects workers. So I am very satisfied with this product. And then I will open the floor for questions, but we already have one. Actually, we have a few. The first one is, should we have a separate ministry for sanitation, or should be part of the health ministry? This is actually related to the third question in the quiz, but a little more specific. Okay?
Yeah, so certainly what Chapter 4 talks about is having sanitation anchored and its planning and the highest levels of government, and preferably in an independent ministry. They don't go as far as saying it should be centralized under one ministry necessarily, because there's so many functions along the sanitation chain, not just within government functions, but also private sector entities. And so even if sanitation was centralized, there would still be a large amount of coordination that would need to happen with non-state actors as well. So certainly calling for high-level coordination, preferably under the Prime Minister's office.
Next question is from Kelly Bridges. How do the guidelines on sanitation and health support the implementation strategy for the Secretary General's call to action on WASH in healthcare facilities?
Okay, so that's a good question. That's something that's also happening in our team here right now. I mean, firstly, it includes the WASH and health facilities very clearly as one of the health sector functions. So some of the other areas for the health sector are a contribution to standards and norms, or contribution to coordination, but very clearly under the health sector functions is a direct responsibility by Ministries of Health for health facilities. So we're working in coordination with these guideline development and the campaign to support the call to action in health facilities. And there's new JMP report coming out shortly with figures on health facilities, as well as the campaign which my colleague Maggie Montgomery is launching.
Thank you again. And here is the third question. What are the top-level messages for health and WASH sector managers? What has changed?
Well, I short of reiterating, sort of the presentation I just gave, and I think there's a lot there, but I would really focus in on the core recommendations and good practice areas and the role of the health sector. Those would be the places I would point to see where is the really core messages within these guidelines.
Thank you, and thanks Peter Feldman for his question. Now from Dr. Mansour, we have the question on how are these guidelines useful for emergencies?
Yeah, so there's some specific guidance in there. I haven't got the page in front of me, looking at emergency settings. But for those who've been following it, the SPHERE standards have also just recently updated the SPHERE guidance, which is a really specific and well-planned initiative for emergency settings. So it touches on that, but for certainly early phase humanitarian response, I think the SPHERE standards is your first technical guidance document, and the sanitation guidelines can provide some supplementary support to that.
I would add that the guidelines actually do provide information on how health workers should handle sanitation to avoid being part of the problem, because the health facilities and even work in the field when there are these emergencies is extremely sensitive to communicable diseases. And these are actually a significant cause for occupational deaths and also for transmission in cases of emergencies. So the next question is, do these guidelines refer to the previous guidelines on reuse from Arno Rosemary in SEI?
Yes, is the short answer. So I would say that these, certainly across all of WHO's guidelines, they have a common approach, which is the Stockholm Framework and Risk Assessment and Management. And when we look at the full sanitation chain, it's similar to the reuse guidelines. The key difference is that the reuse guidelines were written with the intention of planned reuse in mind, so they include a more comprehensive approach on calculation of health-based targets and using quantitative microbial risk assessment as the basis for that. If you don't know what QMRA is, don't worry about it. You don't need to for these guidelines. The sanitation guidelines also look at the full sanitation chain, but they focus a bit more at the front end. There's a lot more information there on behaviour change and policy and planning and so forth. So the short answer is that the two are aligned, and the reuse guidelines are a little more quantitative in their approach and with a stronger focus on the back end of the sanitation chain, which is the reuse environment.
So we have a few participants who are typing right now, but on my part, could you please tell us how you would think that participants can take these guidelines and disseminate them in their own work?
Right, so depending on, so depending on what kind of organization you're in, I think it'll be a little bit different. But firstly, what I would suggest that you do is kind of convene whichever groups you're in. So if you're at the country level, if there's a WASH stakeholder platform. I saw somebody asked if we could share the presentation. The answer is yes. You're very welcome to use this presentation with whichever stakeholder platforms you have, whether that's within your university group or the WASH platform at country level. And I think then to really kind of look and see which are the areas within the guidelines where you have the most improvements that need to be made, and then to use that process to design specific new activities responding to areas within the country context or your research context where you're not doing as well according to the recommendations as you might like to be. And also just add to that, it's World Toilet Day. We'd love for you to be joining with us and spreading the word through social media, through your newsletters or any platforms you have where you think that your stakeholders would benefit from having knowledge of what's in these guidelines.
I can see that the participants are sharing with us their ideas, like blogs, sharing with colleagues, students, national launch, etc. And so there's two questions now. One of them is, what is the role of financial institutions? Should the developing banks take some responsibility in terms of approving loans to national governments?
Right. I mean, I think that there's kind of, when it comes to financing, I think there are two dimensions of this. Certainly within some of the large development partners or banks that fund into different portfolios. It might be health, it might be water, it might be agriculture. I think with some of the evidence that's come out recently, it's probably frightened some of those donors to think, oh well, is wash or sanitation, is it a good investment? I mean, I think the message to those types of decision makers who are trying to decide whether they should invest in vaccines or sanitation, we need to be really clear that the theory of change around sanitation is not broken. The evidence certainly points towards effectiveness of sanitation interventions, but we do need to do better. So I think we definitely want to reinforce the message that sanitation is a good investment and the sector is working hard to do better. Within the WASH community itself, on financing, I think we need to look at what we're financing. So not necessarily being wedded to certain technical solutions. There's probably been a preference by some large financing institutions to support sewerage alone, and we're seeing a lot more innovation happening now, understanding that if we really want to improve health, we need to not just look at familiar technological interventions, but really understand the context and be supporting interventions with a mix of technologies, on-site and off-site services, involving markets, and much more innovative approaches to financing all aspects of the sanitation service model.
Thank you very much. The last question that I received is a question about having a short video on the guidelines. Is there one? A promotional video?
Aside from what you're just watching, no, I guess not. I mean, but it's a good point. I think what we're seeing, we're getting lots of requests for more detailed learning information, videos. We're taking all of that on board, and I thank you for these suggestions. We'll try to fill these gaps with more, more learning materials, more interactive ways of sharing the guidelines with a wide audience, and a video would be a great idea.
By the way, we tell the participants that this webinar is being recorded and will be broadcast later on. We do have 3 more minutes. We do have 3 more minutes for questions. So we have a next one about how do you consider that these guidelines are very friendly to the end user, which is the most vulnerable? Do they also state bottom-up approaches?
Yes, is the short answer. I mean, they're not designed to be used directly by the most vulnerable people, but they're certainly designed to ensure that the most vulnerable people are properly considered in planning processes, and of course, obviously, the most vulnerable people are the ones who tend to have the highest disease burden. So all of the recommendations around doing health risk-based programming is driving implementation towards the most vulnerable. Yeah, I think that's the main point there.
The questions keep coming. We have 1 minute left, but here we have the question of what languages do you intend to translate the guidelines into?
Good question. Okay, so we're going to do them into all of the main UN languages. I think it's going to take us a little bit of time to get those completed. The Russian and Spanish are underway at the moment, and French will be coming, as well as Arabic. But since we're in the last minute of the call, I should take the opportunity to also remind people with more questions that Sophie is going to be moderating a SuSanA forum for the next 2 to 4 weeks, and she'll be sharing much more, just little tidbits from all parts of the guidelines and taking questions and facilitating discussion.
Thank you. I see many expressions of thanks. And one last question that we do have time for is, are you planning to present the guidelines at WHO Pan American Health Organization country offices?
The Pan American, the PAHO? Yes, actually, yeah. Well, we've done that. I was just in Guayaquil a couple of weeks ago in Ecuador, where they had the PAHO symposium for all of the PAHO staff members and and their counterparts, and also at the ADIS conference, which is for Latin American engineers. So we've done some events there, but this won't be the end of it. I anticipate we'll be sharing the guidelines at many sessions to come. And for those of you who are going to be going to FSM5 in Africa SAN, we'll be having a 3-hour workshop there, and also at Latino SAN in Costa Rica in April. So there'll be plenty of face-to-face opportunities at the major conferences to find out more. I should also say, one final point, we will be doing a big print run of these and be circulating hard copies to participants of at events, and also we can post them out to larger institutions and things. So stay tuned for that as well.
Great. It looks like a great initiative. Thanks a lot to Kate, Bruce, and Sophie. And I just have a few closing words. It is absolutely unacceptable that anyone, anywhere, should have to live, work, go to school where there is not a toilet to provide dignity and safety. The initiative that has been presented here today is a tool that can allow us to speed up progress and change the lives of the 4.5 billion people who are today left behind for the want of a toilet. On behalf of the 2018 Task Force for World Toilet Day, I would like to thank you for joining the webinar, for your engagement, and to wish you a happy World Toilet Day. Thank you.
Thanks to you too, Carlos, and the task force.
Have a good toilet.
Thank you, Carlos.